There is a specific walking pace, a precise speed range that researchers have identified. That makes the difference between a walk that genuinely improves your erections and one that does almost nothing for them. Most men over 60 who walk every single day are walking at the wrong pace, not the wrong distance, not the wrong duration, the wrong speed, and nobody has told them. In just a moment, I'll tell you the exact pace range, along with a simple test you can do right now in your living room, to find out whether you're walking fast enough to benefit your blood vessels. Here's what the research shows about walking and erections after 60, and why the speed you walk matters far more than the number of steps you take. An erection depends on one essential thing, healthy blood flow, and healthy blood flow depends on the condition of your endothelium, the thin inner lining of every blood vessel in your body, including the vessels that supply the penis. As we age, that endothelial function naturally declines. Blood vessels become stiffer, less responsive, and less able to widen when needed. According to research published in the Journal of the American Heart Association, one of the most effective, free, medication-free ways to improve endothelial function isn't a supplement, and it isn't a special diet. It's walking at the right pace. The problem is that most men over 60 walk at a speed that does very little to stimulate their blood vessels. They're moving, but their vascular system isn't responding. By the end of this video, you'll know the exact pace range. The minimum amount of walking research shows is actually effective, and the one mistake that cancels out many of the benefits of a daily walk. And here's something that surprised even the researchers. Walking 10,000 steps a day, the number many people, including doctors, consider the gold standard, did not significantly improve endothelial function in older men. What actually worked was much more specific, and after we understand the science in simple language, I'll show you exactly what it was. To understand why pace matters, you first need to understand what happens inside your blood vessels. Your endothelium, the inner lining of those blood vessels, produces a remarkable molecule called nitric oxide. Nitric oxide is the chemical signal that tells your blood vessels to relax, widen, and allow more blood to flow. Without enough nitric oxide, blood vessels remain narrow. And without healthy blood vessel dilation, an erection becomes much more difficult, regardless of testosterone levels, desire, or anything else. Brisk walking stimulates the production of nitric oxide. Slow walking, at least in older adults, usually doesn't provide enough stimulus to create measurable improvements in vascular function. One study published in the Journal of the American Heart Association followed sedentary adults over 50 and measured endothelial function using a test called brachial flow-mediated dilation, one of the best ways researchers assess how well blood vessels respond. The findings were striking. Endothelial function improved only in participants who completed at least 20 minutes of moderate intensity walking each day, in continuous sessions lasting at least 10 minutes. People who simply reached 10,000 steps through scattered movement throughout the day showed no significant improvement. Even participants who accumulated 30 minutes of moderate activity in short bursts failed to see meaningful changes. The blood vessels responded to sustained, moderate-intensity effort, not simply to moving more throughout the day. Another major study, the Physician's Health Study, one of the longest-running cardiovascular studies in the United States, found that men who routinely walked between 3 and 3.9 miles per hour had a 25% lower risk of cardiovascular disease and a 37% lower risk of death, compared with men who did not walk regularly. At that pace, the vascular system receives the consistent stimulus it needs to maintain and repair endothelial function. That's the biology. Sustained moderate walking increases nitric oxide production. Nitric oxide helps blood vessels relax and widen. Healthier blood vessels support stronger blood flow. And healthy blood flow is essential for better erections. Now that you understand the science, let's look at exactly how to put it into practice. The first thing you need to do is walk at the right pace. The Cardiovascular Health Study, which followed older adults over many years, found that men who regularly walked faster than 3 miles per hour had about a 50% lower risk of coronary heart disease, stroke, and overall cardiovascular disease compared with men who walked slower than 2 miles per hour. That reduction in cardiovascular risk is closely linked to erectile health, because the same damage that affects the arteries supplying the heart also affects the arteries supplying the penis. A pace of 3 to 4 miles per hour feels brisk, but sustainable. Your arms swing naturally, your breathing becomes deeper, and you can still carry on a conversation, but singing comfortably becomes difficult. If you use a treadmill, start at 3 miles per hour this week, then gradually increase to around 3.5 miles per hour over the next couple of weeks. If you walk outdoors, use a free GPS app on your smartphone to check your pace. Many men over 60 discover they're walking between 1.8 and 2.4 miles per hour, well below the level shown to improve vascular function. Walking at the right pace isn't just about erections. The men who maintained this speed were also more likely to stay independent later in life, continuing to drive, manage their homes, and remain active well into their 70s and beyond. The second strategy is surprisingly simple. You don't need a treadmill, a smartwatch, or even a GPS app. Your body already tells you whether you're walking at the right pace, if you know how to listen. Researchers use something called the talk test to measure moderate exercise intensity. The principle is straightforward. If you can speak in complete sentences, but you can't comfortably sing, you're very close to the ideal intensity for improving endothelial function. If you can recite an entire paragraph without pausing for breath, you're probably walking too slowly. If you struggle to finish even a single sentence, you're likely pushing too hard to maintain that pace for long enough. The ideal zone is somewhere in the middle. Comfortable conversation with just a little effort. On your next walk, try saying a few sentences out loud every few minutes. Adjust your pace until speaking feels natural, but slightly challenging. That is the level that encourages nitric oxide production and supports healthier blood vessels. If you're planning to try the talk test, let me know in the comments by typing testing. I'd love to see how many people are hearing about this for the first time. Now let's talk about one of the biggest myths in fitness. The idea that 10,000 steps a day is all you need. This finding surprised even the researchers. In the study I mentioned earlier, participants followed 3 different walking programs. One group aimed for 10,000 steps every day. Another group accumulated at least 30 minutes of moderate activity throughout the day in any combination. The third group completed at least 20 minutes of continuous moderate intensity walking, with each walking session lasting at least 10 uninterrupted minutes. Only the third group showed significant improvement in endothelial function. Simply reaching 10,000 steps, especially if those steps were spread throughout the day at different intensities, did not produce measurable improvements in blood vessel function. Your blood vessels respond to continuous stimulation. A brisk 20-minute walk provides that signal. 10 minutes of walking, followed by hours of sitting, then another few minutes later, simply doesn't produce the same effect. If you currently spread your walking across the day, try reorganizing it. Aim for 1 continuous 20-minute brisk walk, or 2 uninterrupted 10-minute walks if that's easier to begin with. The important factor isn't just the total amount of movement. It's maintaining the effort long enough for your blood vessels to respond. The fourth point may completely change the way you think about walking speed. A slow walking pace isn't always just a sign that you're getting older. It can also be an early warning sign that something deeper is happening inside your cardiovascular system. A landmark study published in the BMJ found that older adults in the slowest group of walkers had roughly 3 times the risk of dying from cardiovascular disease compared with faster walkers of the same age. Slow walking speed isn't simply a measure of fitness. It can be a biological marker of vascular disease that's already developing. The same narrowing of blood vessels that affects your heart can also reduce blood flow to the penis. If you've noticed that your walking pace has gradually slowed over the past year or 2, that climbing stairs feels harder, that friends seem to walk ahead of you, or that your usual route now takes noticeably longer, those changes are worth discussing with your doctor. If you take medications such as beta blockers or calcium channel blockers, remember that these drugs can limit your heart rate response during exercise. In that situation, the talk test becomes a much better guide than trying to reach a specific heart rate. Never push through chest pain, dizziness, or severe discomfort just to hit a certain walking speed. Instead, speak with your doctor about using walking as part of your treatment plan, and ask what pace is safe for your individual health conditions and medications. If your walking speed has been declining, don't dismiss it as just getting older. Treat it as valuable health information, and bring it up during your next medical appointment. Now let's look at another simple adjustment that can make a noticeable difference. Most men over 60 assume that if they want to improve their walking, they simply need to walk for longer. But the research points in a different direction. How fast you walk matters more than how far you walk. And one of the easiest ways to increase your pace isn't by pushing harder with your legs. It's by improving your walking mechanics. Lengthen your stride just slightly. Not so much that it feels forced, just enough to make each step a little more efficient. At the same time, deliberately swing your arms from the shoulders instead of keeping them stiff at your sides. A natural arm swing helps generate forward momentum, activates your core muscles, and raises your heart rate into the moderate intensity zone without placing extra stress on your knees or hips. On your next walk, try this for just 5 minutes. Swing your arms naturally from the shoulders, take slightly longer steps, and notice how your pace changes. Many people find they naturally increase their speed by about 0.3 to 0.5 miles per hour, enough to move from below the vascular threshold into the range where blood vessels begin responding more effectively. An interesting bonus. A faster walking pace is also one of the strongest predictors of maintaining independence later in life. It is associated with better stair climbing ability, greater strength for everyday activities, improved balance, and a lower risk of disability. Walking faster isn't just about protecting your heart. It's about protecting your independence. Now let's discuss 5 warning signs that mean your walking difficulty may be more than a fitness issue and deserves medical attention. The first warning sign: you develop chest pain, pressure, or tightness whenever you try to walk briskly, and the discomfort disappears when you stop. Do not ignore this. Do not try to push through it. Contact your doctor immediately. The second warning sign: you experience sharp pain in your calves after walking for a few minutes, and the pain completely disappears with rest. This pattern may indicate peripheral artery disease, a condition caused by narrowed arteries that reduce blood flow to the legs. The same process can also affect the arteries supplying the penis, so it deserves prompt medical evaluation. The third warning sign: your walking speed or endurance suddenly declines over several weeks or months, without any injury or illness to explain it. An unexplained decline in walking ability can sometimes be one of the earliest signs of worsening cardiovascular disease. The fourth warning sign: you become dizzy, lightheaded, or feel as though you might faint whenever you increase your walking pace. That isn't simply poor conditioning. It's your cardiovascular system telling you it may not be able to meet the increased demand. Before continuing an exercise program, you should be evaluated by your healthcare provider. And finally, the fifth warning sign: you notice both worsening erections and declining walking ability happening around the same time. Research shows these problems often share the same underlying cause: reduced vascular health. When both symptoms appear together, it's important to discuss them with your doctor and consider a comprehensive cardiovascular evaluation. If any of these warning signs apply to you, pause your exercise plan until you've spoken with a healthcare professional. Your health comes first. This video will still be here when you're ready to continue. For everyone else, here's a simple walking protocol you can begin today. First, your pace target. Aim to walk between 3 and 3.5 miles per hour. Use the talk test to confirm you're in the correct intensity zone. You should be able to hold a conversation, but speaking should require just a little effort. If you're using a treadmill, simply set the speed and maintain it throughout your walk. If you're outdoors, use a GPS app, Google Fit, Map My Walk, or your phone's built-in health app to check your pace. Don't rely on guessing. Most men believe they're walking at about 3 miles per hour. Research suggests the average is much closer to 2.1 miles per hour. Knowing the actual number makes all the difference. Next, your duration. Aim for at least 20 continuous minutes of brisk walking, 5 days each week. If that's too difficult right now, start with 2 uninterrupted 10-minute walks, separated by a short 5-minute seated rest. As your endurance improves, gradually work toward 1 continuous 20-minute session. Finally, your progression. Every 2 weeks, increase your total walking time by about 2 minutes. Keep the pace the same. Don't try to walk faster every week. Your pace is already where it needs to be. Instead, build endurance by increasing duration slowly and consistently. Many people notice better stamina within 3 or 4 weeks. And improvements in erectile function often begin to appear within 6 to 10 weeks, which matches the time researchers typically observe measurable improvements in endothelial function. Here's one more simple way to make sure you're walking at the right pace. As soon as you step outside, count how many steps you take in 15 seconds. Now multiply that number by 4. That gives you your steps per minute. For most adults, walking at about 3 miles per hour equals roughly 100 steps per minute. If your total is below 100, gradually increase your pace until you reach that target. It's a quick, free, and surprisingly accurate way to check your walking intensity. You don't need expensive equipment. Just a watch or the clock on your phone. Try doing this at the beginning of every walk for the next couple of weeks. Before long, the correct pace will become second nature. The only other things you need are a safe place to walk and about 20 minutes. A neighborhood sidewalk, a park, or a quiet road will do just fine. The research wasn't carried out in high-tech gyms. It was conducted with ordinary older adults walking in everyday environments. The biology doesn't require fancy equipment. It requires the right pace, consistency, and commitment. Let me give you a real-world example. Raymond was 67 years old, a retired mechanic. Every morning, without fail, he walked his dog for 45 minutes along the same route. He rarely missed a day, and he was proud of his consistency. But over the previous 2 years, his erections had gradually become weaker. During a routine medical checkup, his doctor also noted that his cardiovascular risk was increasing. Raymond assumed it was simply part of getting older. What neither he nor his doctor had realized was that his entire 45-minute walk was being done at less than 2 miles per hour. He was walking every day, but he never reached the intensity needed to stimulate nitric oxide production or improve endothelial function. His blood vessels weren't receiving the signal they needed to adapt. So Raymond made one simple change. Instead of strolling slowly, he increased his pace to about 3.2 miles per hour and completed his walking in 2 15-minute brisk sessions. 8 weeks later, his blood pressure had improved. A few months after that, he also noticed more reliable erectile function. He was still the same man, walking the same route, for roughly the same amount of time. The only difference was his pace. Before your next doctor's appointment, there are a few things worth preparing. First, bring your actual walking pace. Use the number from your GPS app or calculate your steps per minute. Don't rely on estimates. Doctors can do much more with objective numbers than with vague descriptions. Saying, "I currently walk about 2.1 miles per hour, and I'd like to safely increase that to around 3 miles per hour," provides useful clinical information. Simply saying, "I walk every day," doesn't tell your doctor very much. Next, tell your doctor something like this: "I've learned that walking pace may be connected to both cardiovascular health and erectile function. I'd like to use walking as part of my treatment plan, and I'd appreciate your guidance on a safe pace based on my health conditions and medications." That tells your doctor you're interested in evidence-based lifestyle changes and want advice tailored specifically to you. One thing to avoid: don't assume that walking every day automatically means you're walking at an effective intensity. Pace is often the missing piece, and unless you mention it, your doctor may never think to ask. Finally, consider asking one simple question. Does my current walking speed tell us anything about my erectile function, and can we measure it today? It's a straightforward question that can open an important conversation about cardiovascular health, exercise, and overall vascular function. Measuring walking speed takes only a couple of minutes. Yet very few patients ever ask for it. You can be one of the few who do. Before we finish, I have a question for you. How fast do you think you currently walk? Has anyone ever told you that your walking pace could influence both your cardiovascular health and your erections? Let me know in the comments. Whether your answer is fast, slow, or I'm not sure, every response is valuable. It helps me understand where people are starting and what topics you'd like me to cover next. If you're watching this with your spouse, your partner, or someone you care about, here's the most important takeaway. Many men walk every day and genuinely believe they're doing everything possible to protect their health. And they deserve credit for that. But if that daily walk is little more than a slow stroll, the research suggests it may not provide enough stimulus to improve the health of their blood vessels. The conversation at home shouldn't be, "You need to walk faster." Instead, try saying something like, "I learned that walking pace may be more important than step count. Why don't we try walking together at a slightly brisker pace this week and see how it feels?" That small change, from a relaxed stroll to a purposeful brisk walk, may be one of the simplest lifestyle improvements you can make. And doing it together often makes it much easier to stay consistent. In my next video, I'll discuss something that affects a large number of men over 65 who take medication for high blood pressure. Some commonly prescribed blood pressure medications have been linked to changes in erectile function. Yet many men are never told about this possibility. If you've started blood pressure medication during the past few years, and you've noticed changes in your erections, you won't want to miss that discussion. Subscribe so you'll be notified when it's released. If you enjoy practical, research-based information explained in plain language, this channel is for you. Every video is built around findings from peer-reviewed medical research, then translated into clear, practical advice you can actually use. There are no miracle cures, no supplements to sell, and no unrealistic promises. You've already done something important. You've been walking. That consistency deserves recognition. Today's message isn't about starting over. It's about becoming more precise. The same walking shoes, the same route, the same 20 minutes, but at 3 miles per hour instead of 2. That small adjustment changes how your blood vessels respond. Nitric oxide production increases, endothelial function improves, and the cardiovascular system that supports healthy erections receives the stimulus it needs. You don't have to completely change your lifestyle overnight. Sometimes, you simply need to pick up the pace. On your very next walk, try the talk test. Check your pace if you can, and then come back and let me know what you discovered. Thanks for watching, and I'll see you in the next video.